Thank you for watching. This is YouTube Medical University. Let me ask, the medicine you believed was good for you and have been taking, that over-the-counter cold medicine might actually be delaying your recovery. How would you feel if that were true? When you wake up feeling sluggish, you might wonder if you've caught a cold. You feel chills and a scratchy throat. Sometimes you think, maybe I'm coming down with something.
What do you do then? At the drugstore, you see medicine for sore throats or runny noses.
You might find combination medicines with tranexamic acid or dextromethorphan. I think a lot of people buy medicines that contain cough suppressants. I think there are a lot of people who wonder if these really work, or buy them thinking they're better than nothing. In this lesson, without being misled by common information, based on scientific evidence, what can we really expect to be effective? I want to get to the bottom of that mystery. By the time you finish watching this video, you should be able to feel less vague anxiety about colds and be able to decide, for example, if it's okay to just wait and see, or which medicine to choose if you need to take something. Please watch until the end. So here's today's agenda. First, in the first section, we'll talk about what you're probably most curious about. I'll explain which medicines doctors truly rely on and which they don't. In the second section, I'll explain why some medicines don't work and what a cold is, using interesting analogies. In the third section, as a doctor who often treats colds, I'll share key lifestyle tips to help you recover faster. I'm sure some of you have a cold right now. So let's get straight to the point and start with the first section. I actually work at a hospital myself. I sometimes prescribe cold medicine or take it myself when I catch a cold. Based on that, here are the top 3 medicines doctors often use. These medicines are also sold over the counter, so listen in. Here are the top 3 medicines doctors trust most. Number 3 is Kakonto. If you feel chills, shivers, or think you might be coming down with a cold, Kakonto is said to be effective in the early stages of a cold that causes chills like this. Kakonto actually contains something called ephedrine. It has the effect of stimulating the sympathetic nervous system, so your body warms up and you naturally start to sweat. Because of this effect, the initial chills from a cold ease, you start sweating, and your fever slowly drops. These are the expected effects of Kakonto. So if you have chills, remember this. Kakonto might be a strong ally for colds of this type. When I was on night duty, a senior 1 year above me said he was starting to feel chills and thought he might get a fever, so he took Kakonto and continued working. Of course, I want people to take time off when they're not feeling well, but sometimes you just can't take a break. Many doctors rely on it in these situations. Remember, there are 2 types of colds. Kakonto works well for colds with chills, but if you lack chills, have a high fever, it's been several days, or your sore throat and inflammation are severe, it's thought Kakonto may not work for that kind of cold. I've taken it and felt its effects, but this herbal medicine is also a traditional Eastern medicine, and there is still little data from studies comparing people who took it and those who didn't, clearly showing that those who took it had milder symptoms. I'll discuss this in the second period, but since colds usually resolve on their own, many doctors take medicine to speed up recovery or feel better sooner. There are also some precautions, as this ingredient called ephedrine can put some strain on the heart and blood vessels. If you have a chronic illness, always consult your doctor first. These are the top 3 medicines doctors rely on. Second place goes to honey. This might be surprising to many people, but to get straight to the point, a cold will get better on its own, even if you leave it untreated. Basically, the role of cold medicine is to improve the symptoms and make them less severe. However, among the many cold medicines out there, there are very few that have clearly shown improvement in symptoms when taken. Among them, actually, honey is said to be effective. There was an analysis that gathered and reviewed studies from around the world. According to a highly reliable paper called the Cochrane Review, giving honey to children over 1 year old before bedtime, the group clearly had a reduced frequency of coughing, and the severity of the cough was also eased compared to children who did nothing or took a placebo. And there is highly reliable data showing that it also improved sleep quality. What's even more interesting is that dextromethorphan, which is included in over-the-counter cold medicines sold for cough-type colds, when comparing this cough suppressant ingredient and honey, the conclusion was that there was no significant difference. Isn't that surprising? When I was actually training, there were doctors in pediatrics who advised giving honey before bed for children with colds. So, many doctors believe that adults can also expect sufficient effects from taking it, and they drink it themselves. Doctors sometimes use honey instead of medicine. Isn't it real that they're relying on real food? However, please never give honey to children under 1 year old, as there is a risk of infant botulism. This is an important rule, so please follow it. Doctors primarily rely on antipyretic and analgesic drugs. These include acetaminophen, loxaprofen, and loxonin. These medicines are prescribed in hospitals, but they are also available over the counter. If it's acetaminophen, Tylenol contains only acetaminophen as its active ingredient and no other components, so it's very reliable and easy to use. For loxaprofen, there's Loxonin S, for example. Kunihiro's loxaprofen tablets contain pure loxonin with very few other ingredients, so I highly recommend them. The reason I'm mentioning these medicines is because, including myself, most of the doctors around me rely on these antipyretic analgesics. Of course, there is no data showing that these medicines will cure a cold faster. However, if you take them, your sore throat will ease and your fever will go down significantly. It's tough to stay in a state of high fever, and when you sweat, dehydration or a loss of appetite weakens your immunity further, making your cold last longer. Many doctors rely on these kinds of medicines to make themselves as comfortable as possible while they're recovering. A medicine called acetaminophen works relatively mildly. It's a drug that's often used for children and pregnant women. Of course, if you're pregnant, please consult with your obstetrician gynecologist. Since it's called an antipyretic analgesic, it not only lowers fever but also relieves pain, so it's okay to take it for a sore throat as well. Loxaprofen is an antipyretic analgesic that targets the source of pain. Instead of only lowering fever, it more effectively reduces inflammation and relieves pain. It's a medicine that's often taken when you have a burning sore throat or when your headache gets worse from a cold. It can put a strain on your stomach, and people with reduced kidney function need to be careful. You have acetaminophen and loxonin. If you're wondering which one is better, I've posted a comparison video in the past, so please check it out from the description or comments after this. Here at YouTube Medical University, we share easy to understand, data-based medical information from the perspective of practicing doctors. I'd really appreciate it if you could subscribe to the channel so you don't miss any new videos. So on the other hand, are there any cold medicines that doctors themselves don't really take? To make this video, I interviewed some of my colleagues, and there are two categories. I'll mention medicines doctors rarely take because they're cautious about them. Doctors are cautious about these top two cold medicines. Number 2, prescription drugs, which have different effects for each person. Even doctors disagree on them. This means medicines like dextromethorphan, a cough suppressant, or carbamazepine, which helps clear phlegm. Medicines like tranexamic acid, which reduces throat inflammation, are sold at drugstores for each symptom, and hospitals can also prescribe these medications. I sometimes take these medicines myself. Although some research shows they're effective, other reports say they work little better than nothing. Individual responses vary. A person might say, "This medicine worked for me before, so I want it again." That's why doctors consider each patient's condition, other illnesses, and current medications. We carefully look at the medications and other factors before deciding which medicine to prescribe. I can't recommend it to everyone, and some doctors say a cold will improve on its own. Some doctors avoid prescribing these medicines due to concerns about side effects. I hope you understand this is the reality. Doctors avoid two main medicines. The first is the so-called general cold remedy. A lot of people probably rely on these medicines, don't they? I don't want to completely deny the value of these medicines. When you're in trouble, thinking you can just take this medicine is really comforting, isn't it? When you're struggling, it's easier to have a medicine with all the ingredients than to choose or buy separate ones. I understand why people take that kind of medicine. But there are hardly any doctors around me who take this medicine. The reason is that even when I see patients with colds, there aren't that many people who have all the symptoms of a cold at once. Some people have a fever and sore throat without a runny nose, while others have a cough and runny nose, but no sore throat. Symptoms vary by person. However, combination cold medicines include ingredients for every cold symptom. When you take the medicine, you end up taking ingredients you don't actually need. This means there are no benefits, only the downside of side effects. Not only that, but many combination cold medicines contain ingredients that make you drowsy, so sometimes caffeine is added in hopes of counteracting that effect. However, if caffeine causes insomnia or a racing heart, it defeats the purpose. Some patients have even come to the clinic complaining that their mouths became dry and it became uncomfortable for them. For these reasons, while combination cold medicines are certainly reassuring to have at home and can be a strong ally, the reality is that few doctors actually take them themselves. Thanks for watching this far. If you found this helpful, give it a thumbs up. Also, share any remedies or medicines you use for a cold. Let me know in the comments. Now, in the second part, I'll explain what a cold actually is and why there are so few effective medicines for it. The true nature of a cold, also known as acute respiratory infection, can be simply explained as follows. What this means is that areas like your nose, throat and trachea, these kinds of places, are where viruses settle in the airways. That's the situation. It's not germs or bacteria, it's a virus. In the past, when people caught a cold, they were sometimes prescribed antibiotics or antibacterial drugs. These are medicines for germs and bacteria. So, since colds are caused by viruses, taking antibiotics basically won't cure them. However, many people still think of antibiotics when they catch a cold out of habit, so some mistakenly believe they won't get better unless they take them. But surely, it's not that you got better because you took the medicine, but it's more likely that you naturally recovered because it was just a cold. Many viruses cause colds, including rhinovirus, adenovirus, and even influenza in a broad sense. Actually, defeating these viruses is known to be very difficult even throughout the history of living things. Defeating viruses like rhinovirus and adenovirus, the truth is, there's no specific cure yet, so nothing can be easily taken. If a medicine that can defeat the viruses that cause the common cold were developed, it might be worthy of a Nobel Prize. So, in reality, the medicines you get at drugstores or are prescribed at hospitals aren't meant to defeat the virus itself, but rather to relieve symptoms like a runny nose, cough, or sore throat that come with it. So, whether you take them or not, basically, it's our body's immune system that defeats the virus. It's not the medicine. If we use a fire as an example, when a house catches fire, firefighters come and put out the flames with hoses, right? But when facing a cold's fever, there are no firefighters. And the medicine we take, medicine isn't just about putting out fires. It's more like opening windows to ventilate and manage the fire's effects. It clears out the smoke or makes you lower your posture to avoid breathing it in. It's medicine meant to buy you time and prevent complications that come with it. In the end, it's your immune system that puts out the fire of a cold. That's why, as I'll discuss in the third period, getting enough sleep and eating are important. Those basic lifestyle habits are actually very important. And when it comes to colds, not everything should be treated the same way. If you take antibiotics too easily, it's not just a disadvantage for you. Taking antibiotics unnecessarily can change the balance of bacteria in your body. Because of that, bacteria can evolve to become resistant to antibiotics. If such bacteria appear, there's a possibility that many people could get infected by bacteria that no antibiotics can treat, causing serious harm. That's why we doctors try not to prescribe antibiotics unnecessarily. It's a bit of a complicated topic, but since it's not widely known, I wanted to explain it. So finally, in the third part, I'll talk about the advice doctors usually give to people who catch a cold. I'll explain how you should deal with a cold. There are three main ways to handle a cold. Let me start with the conclusion. The first is to rest and take it easy, and to keep the air humidified. The second is to eat foods that are easy to digest. And finally, the third is to carefully observe your own symptoms and make sure you can go to the hospital if any concerning symptoms appear. These three things are important. First, resting and keeping the humidity right help regulate your immune system. Resting well and not putting extra stress on your body is the way to recover from a cold quickly. Humidity matters too, so keep the room humid by hanging wet towels inside. Try to keep the humidity in your house above 50%. Just like your skin gets rough when it gets dry, dry air can damage your mucous membranes and slow down your recovery from a cold. The second point is to eat foods that are easy to digest. You probably pay attention to your diet when you have gastroenteritis, but please also be careful with your meals when you catch a cold. When you have a cold, your body is inflamed and you often lose your appetite. During these times, try to drink fluids and eat easy to digest foods if you can. If you eat foods that are hard to digest, they can stay in your stomach and cause nausea, so if possible, things like rice porridge, udon noodles, miso soup without any ingredients, or maybe simmered dishes. Foods like these are easy to digest and are quickly converted into energy for your body. Try to eat those foods selectively. Sometimes some people catch a cold. There are many people who think they need to get vitamins or eat vegetables and focus on having a healthy diet, but once you start feeling a bit better, that's fine. But when you're actually feeling sick right now, it's important to just eat what you can. And finally, the third point is not to overlook symptoms that mean you should come to the hospital. I'll start with the conclusion. If you have a high fever for over 3 days, or if it returns after going down, if you feel short of breath and wheeze, or if you get out of breath just by moving and need to rest, or if you can't eat and also can't take in fluids. And finally, if you feel like something is wrong, or if your condition doesn't improve at all even after taking medicine, or is actually getting worse, those are signs that you should go to the hospital. Please make a note of them or write them down in the comments section so you can remember them when you need to and don't forget. How was it? Today I talked about the top 3 cold medicines that doctors rely on and the top 2 medicines that doctors probably wouldn't take themselves. And I also explained what a cold actually is and that the real shortcut to recovering quickly from a cold is actually your lifestyle habits. It was a bit of a long video, but thank you for listening all the way to the end. If you understand this video, I'm sure it will help you in the future and also help those around you. If you found this helpful, please leave a comment or hit the like button. Also, before you forget which channel this is, subscribing would really encourage me. Well then, see you in the next video.